Okay, so now we are going to talk about the pathogenesis of acute pyogenic bacterial meningitis. That exactly what we are going to talk about is that once the microbe enter, let's suppose we talk about the most common organism like pneumococci or you can say meningococci. Once they enter, right, in our body, right, what events really happen? How this whole drama unfolds, which eventually end up into meningitis, right? So let's start with throat. Okay, here is your nose and your other things, your beautiful eyes, right? And yes, here is pharynx, right? Now let's suppose that organism pneumococci or meningococci, which are basically airborne, right, they reach to your throat, right? So first step will be, or should be, the first step should be from microbe viewpoint that first colonize throat, right? They should make their base camp here, and from here in some patients they will be able to succeed into go into deeper part and eventually produce meningitis. So let's start from here that these are mucosal cells in nasopharynx. These are mucosal cells, right? So when the bacteria come over here, then let's suppose here are the bacteria. Now if it is meningococci have special fimbria or pili, right? And those fimbria or pili specially attach with special type of molecules in nasopharynx. So this is one way. What promotes the colonization of throat is, number one, some organism, the example I gave you, meningococci, right, then Neisseria meningitidis, right? So they have fimbria, pili, and then they attach over here. Secondly, there's some other organism like streptococci can be here. Which streptococci? Streptococcus pneumoniae. Or H. influenza can also be here, right, depending upon the bad luck of the patient. Now, what these organisms are going to do? The first thing is colonization, right? Our throat also becomes more vulnerable to colonization under some special circumstances. So what are those circumstances in which our throat is more vulnerable to these organisms? Of course, after viral infections here. If you have viral sore throat, then your defenses are weak and bacteria can easily attach and eventually invade. Or in the smokers, where the columnar ciliated cells, cilia are damaged or cilia are not working well and they are unable to clear off these organisms from here. So what really happens that in smokers or in the people who have viral infection in the throat, they are more vulnerable to colonize such bacteria. Once these bacteria are here, what they have to do? They have to go through mucosa, because eventually we are talking about this story, bacterial travel in a patient where bacteria will eventually succeed in producing meningitis, right? If in some patient bacteria stay here and does not goes deeper, of course it will not produce meningitis. Now we have to see that, let's suppose here is your central nervous system. This is, okay, now bacteria from here has to reach here, right? Let's suppose these are your meningeal cover, right? It's a very functional diagram. Let's suppose these two linings are, inner is the pia and outer is the, yes, arachnoid. Now eventually our bacteria must reach here. Is that right? Now we have to talk about that how this bacteria move from here and how on the way, what is the condition of our defenses, right? What is the condition of our defenses and why in some cases it can be successful to reach here and produce trouble. First defense, yes, here. You know, these cells, mucosal cells, they can secrete IgA. A class immunoglobulin from class A, this is secreted in our mucosa, right? And also in our secretions. Now, actually, first of all, these bacteria have to face IgA. Now, here, especially Streptococcus pneumoniae, they have a very special way to deal with it. Here is your Streptococcus pneumoniae, okay? Here is your Streptococcus pneumoniae. What is this? It has a cutter. What is this cutter? This is an enzyme, okay, let me make it more simple. This component is an enzyme which can digest or destroy the IgA, right? So what really happens, as there is some, again, more simple, it is your Streptococcus pneumoniae, very happy. You know why? Because here is IgA sitting, right? But this can secrete a special type of what is this? This is a antibody cutter. So this organism, which is Streptococcus pneumoniae, in many cases it's pathogenic strains, they release these cutting molecules and they cut the immunoglobulin IgA, right, and make them ineffective. So these are called IgA proteases. What are these called? IgA proteases. This is the first war. From here the IgA comes, from there the bacteria come, and bacteria has this cutter and keep on cutting the IgA, and defense is lost, right? It has beaten the defense, now it can happily multiply here. Is that right? This is one way. Second way is, we talk about the other friend. What is this? Meningococci. This is also laughing. You know why? It has fimbria, right? If it has fimbria, it will stick with fimbria with the mucosal cells. And if it is sticking with the fimbria, it is also protected. You know why? Because one protection mechanism here is that cilia are moving and removing the bacteria, right, from this area up to the esophagus. From there, this mucus along with the cilia here are, yes, moving in a direction and pulling the mucus and bacteria or other particulate matter to the pharyngeal side, and eventually it goes to esophagus and fall into acid pool. But if bacteria keep on sticking there, right, it will not go away. So it will spend more time here and eventually it will find a way go in, right? So I'm just telling you, this is the first fight, bacteria versus our mucosal defenses, right? Either they stick very tightly or they just produce IgA proteases, right? Now, once they colonize here, the next step is to go deeper, because they have to move deep to reach to our circulatory system. These bacteria need to go to our, yes, circulatory system, blood system, because blood will carry them to here, right? Now, how do they move from here to there? Let me tell you. These bacteria, some of the bacteria use a private route and others go in a public style. There is a private pathway and there's a public pathway to move from mucosal surface up to the blood. Now, what is the private pathway? Yes, private and personal. Okay, let me tell you. Actually, some of these bacteria, they are internalized in mucosal cells and they are present in a vacuole. They are present in a vacuole. These are vacuolated bacteria, and these vacuoles release on the, attach on the basal side and release the bacteria to the blood side. So what really happens, that within these mucosal cells, there's a private and hidden pathway that some bacteria enter into a vacuole, and vacuole transfer from apical side to the basal side and take the bacteria from apical side and release the bacteria on the basal side, and this private route is used by meningococci, right? Well, how you will remember, meningococci is for which age group? Adolescents. And adolescents like to do private things. Even the bacteria in them also do the private thing, and they pass through the mucosal cells. Is that right? And this is one way how meningococcus can come here. Okay? But then you know, H influenzae is what? For younger babies. Younger babies can do anything publicly, no problem, right? So as Haemophilus influenzae, which is more common in younger babies, right, it will go by public route. What is the public route? They don't bother to enter into cell, right? They just break down the apical bridges between the epithelial cells. Between the epithelial cell, there are apical tight junctions. They break down these tight junctions. This is a cell and, okay, this is the cell, right? And there is a special bridge here. H. influenzae break down these bridges and go through these bridges and reach here. So what is happening? Either some bacteria go through the cell or some bacteria go in between the cell. So our private route is transcellular. When bacteria are going through the cell, this is called which route? Transcellular. When they are going in between the cell, this is public route, or it is called intercellular route. So once bacteria colonize, destroy the IgA, stick there strongly, and then either transcellular route or intercellular route, they move from mucosal cells to the basal side and enter into circulation. Now bacteria is here. Now bacteria is here. But it is very serious, right? You know why bacteria has to be serious here? Why? Because blood has a lot of defenses against microbes. Our blood is very bloody. You know why? Because it has antibodies there. It has complement proteins there. It has bloody neutrophils there to eat up these bacteria. You get it? As soon as bacteria have entered into circulation, now our circulation has defenses. There may be antibodies present in circulation which may destroy bacteria, or complements, proteins. They love to destroy the bacteria, opsonize the bacteria, and then help in phagocytosis. Even neutrophils are also floating in blood. So now the next step is this bacteria must know how to survive in our circulatory system, because our circulatory system is usually a very, very hostile environment for our for the invading bacteria, thank God. Right? Now, but bacteria which produce meningitis must have some way to pass through the blood and eventually reach here. So how the bacteria beat our defenses like antibodies, complement and neutrophils? Answer is that they have a special helmet. They have a special helmet. This helmet is made of polysaccharides. So these bacteria, they are having a special cover, and this special cover is polysaccharides. And these polysaccharides cover, these are special proteins, polysaccharides are special carbohydrates, and these polysaccharides which normally surround these bacteria protect the bacteria from antibody and complement mediated phagocytosis. This is how they survive. If these bacteria are encapsulated, they will be very rapidly eliminated from our circulation, right? So first step was to colonize here, second step was to migrate to the blood, third is to survive into blood. And to survive into blood, what they do? They have polysaccharide capsules. And polysaccharide capsules are anti-phagocytic material. They don't allow what? A neutrophil to eat this bacteria. It's just like that, you cannot eat a apple which is having a cover of rubber. Or can you eat? Most of you cannot. Is that right? So this is a problem. So neutrophils are there, but they cannot do anything. This is an apple with rubber cover, right? And it's moving here and there, and just nothing. These antibodies, complements, and neutrophil cannot do anything. Is that right? Now they keep on circulating, and eventually, sooner or later, they may find a way to enter in central nervous system. Now, how do they enter into central nervous system? Now, question is, how do they enter into central nervous system, or how do they reach to the meninges, to be more accurate, according to our lecture, where we are going to end up with meningitis. Now, here I will make the third ventricle. What is this? Lateral ventricle. Is that right? Lateral ventricle, third ventricle, and again, this is not an anatomical diagram, it is just a functional diagram, right? This is aqueductus sylvius. What is this? Yes, please. Fourth ventricle, and here, yes, spinal canal. What foramen is here? Yes, foramen Lashka, and here it is foramen Magendie. M for median, Magendie. L for lateral, Lashka. Okay? Now, question is that this bacteria need to reach here in the ventricular system, or it need to reach here, because it has to reach to the CSF, cerebrospinal fluid. Now, cerebrospinal fluid, let's suppose here is the pia mater, right? And here is subarachnoid space. Now, CSF is present here and CSF is present here. Now, bacteria need to reach to CSF. Now, it is present in blood. Now, what will happen? One way to reach there is that it will approach, bacteria will move into choroid vessels. Which vessels? Choroid vessels. Now, if you know about choroid plexus, this is a choroid vessels which produce special type of vascular bundles which eventually lead to what? Release of secretion of CSF. Right? Suppose this is choroid plexus. Is this choroid plexus in lateral ventricle or middle ventricle? Of course, lateral, right? Third ventricle has choroid plexus here. Fourth ventricle also has choroid plexus here. But I'm just showing that this has gone into choroidal what? Vessels. If it goes into choroidal vessels, right, and eventually it lodges here, it reaches here, right? Then it will penetrate through the choroidal blood vessels, and again there are endothelial cells here. So they will pass through the endothelial cell. This is the second migration. First migration was from here to blood. Now from blood to CSF. Second migration, they will pass either through the through the endothelial cell or in between the endothelial cell. So again, they will pass by both. Some of them will go through the endothelial cell, that is transcellular route. Some will go by secret route, others will go by public route. So what I'm saying, that as here, some bacteria can go transcellular, other bacteria can go intercellular. In the same way here, in between the endothelial cell, some bacteria will go transcellular, other will go interendothelial, and then they come to ependymal cell, then eventually jump into, what is this? CSF. They jump into CSF. This is one way to reach. Other way to reach is that they go to blood vessels, cerebral blood vessels. Where they go? They go to cerebral blood vessels. I'm just showing a vessel, and again these are endothelial cells. These bacteria, they pass through circulation and eventually they reach through the cerebral blood vessels, reach to cerebral capillaries, and then bind with cerebral endothelial cells. They bind with cerebral endothelial cells, and again either transcellular or intercellular, they jump into CSF in subarachnoid space. So this is how bacteria eventually reach to the CSF. Again, let me repeat. Step number 1, colonization here. You need to remember IgA protease is produced by pneumococci and special fimbriae to stick here, meningococci. Then they can go either transcellular or step number 2, migration, transcellular or intercellular. Then circulation, but survival in circulation. They beat the complement system, antibody system and neutrophil by virtue of presence of helmet, rubber cover. What is that? Polysaccharide capsule. And eventually by chance, if they enter into cerebral circulation or choroidal circulation, then they do second migration, right? They pass through the interendothelial cell or in between the endothelial cell, transcellular or intercellular, and they jump into CSF. And once they come to the CSF, they have gone to heavens, paradise. CSF is a great place for bacteria to enjoy their life. Yes, that is true. You know, they have worked so hard, and then God wants to give them a little relief. So as soon as they reach to the CSF, they get the relief. Why? There are no defenses there. There are no effective defenses there. CSF does not, CSF is protein poor fluid. So CSF is cerebrospinal fluid, by the way. So CSF does not have very little concentration of antibodies, very little concentration of complement proteins. So do you think these bacteria will be opsonized here? No. Is that right? Thirdly, the major fighter against the bacteria for phagocytosis. The first line of cells is neutros. The good news is that, good news for the bacteria, not for the patient. Good news for the bacteria is that when it will come here, it is happy, there is no complement, there is no antibodies, very little antibodies, and there's simply no neutrophil. Simply no neutrophil. Remember, CSF may have few white cells. CSF may have few white cells, but all of them are mononuclear. None of them is neutro. All of them are lymphocytes. Normal CSF, in 1 microliter, there should be less than 5 cells, and all cells should be lymphos. Normal healthy person CSF should not contain even 1 neutro. So what happened then? Bacteria are happy, right? The moment they reach here, no complement, very little complement, very little antibodies, and no neutrals. They are in a paradise. Why they are in paradise here? No defenses. At the top, they can have a free ride. Why they go free ride? Yes, because CSF is circulating. From the choroid plexus, it is secreted in lateral ventricle, then CSF come into third ventricle, again more choroid plexus add, then CSF aqueduct, then it comes out through foramen, Leschke and Magendie and subarachnoid space, and CSF keep on circulating around the brain then, and eventually it goes to the top. And when CSF goes to the top, here is what? Dura mater. What is this? Dura mater. And dura mater has 2 layers, 1 layer indent here, and this gap produced by between this layer and this layer, this is called, this is sagittal sinus, right? Now this is dura mater around it, and here dura mater has some gap, right? And here is, oh my god, this is arachnoid matter. Arachnoid matter produces some pouches here, right? This is arachnoid matter here. So what really happens? As soon as bacteria come here, they get a ride on circulatory system of CSF, right? So CSF is moving and bacteria are riding and rapidly spreading. So they move from here and then go through the ventricles, and then they come out, or if they are already out, that is good, and from there they will start moving around. They will keep on multiplying, very very favorable environment, and then they eventually CSF, what happen, it goes to, what is this area? Arachnoid granulations, and from here CSF goes to venous drainage. You know, CSF is formed by arterial site, choroidal arterial site, and then CSF goes into ventricular system, and then into subarachnoid space, then cerebrospinal fluid drained by, what is this? Drained by arachnoid granulation and villi into dural venous sinuses, and then it will be taken by internal jugular veins and other drained to the right heart. Am I clear? Now these bacteria are in a happy time because they come here, as CSF is being constantly produced, they keep on moving and floating, and after some time bacteria will be spread all around the leptomeninges. Within that, all the pyometer and everywhere, bacteria will be happy. Remember, CSF is an excellent culture medium for bacteria, for most of the bacteria. It's an excellent culture medium. Low antibodies, low complement, no neutrophil initially. Is that right? So they multiply here and circulate very rapidly, and now these bacteria are there. Am I clear? Yet disease has not started fully. Yet disease has not started fully. It is just arrival and multiplication of bacteria. Something else is going to happen now. You know, in this happy place, bacteria will start shedding their toxins. Some bacteria will undergo lysis, and when bacteria will undergo lysis, gram-positive bacteria, of course there are some bacteria gram-positive, another bacteria gram-negative, right? Gram-negative bacteria, when they are circulating here, classically like E. coli, they will release from their cell wall component. Gram-positive bacteria will also shed their cell wall component. From gram-negative bacteria, they will release here lipopolysaccharides, which are also called endotoxins. What are called? Endotoxins. So what bacteria will do, while they are circulating, while they are multiplying, they will start releasing, now they will start messing, right? Either they start releasing the endotoxins, or when some of the bacteria undergo lysis, they release endotoxins. So what is happening now? Endotoxins are being released. I will put a red color with that. This is what is dangerous. Lipopolysaccharide. And gram-positive bacteria, of course, they don't have lipopolysaccharide except Listeria monocytogenes. Now, gram-positive bacteria, they release their own product when they undergo lysis. They release teichoic acid, and they release peptidoglycans. Now, these are nasty things because they challenge our immune system. If they are happy, they stay there, maybe we are not bothered so much. But when they start really challenging, then body has to do response. So what really happens? Step 1, colonization. Step 2, transmigration. Step 3, survival in circulation. Step 4, again, transmigration from circulatory system to CSF. Step 5, multiplying in CSF. Happy place. And step 6, releasing the toxins, bacterial products, either by intact bacteria or bacteria going under lysis spontaneously. And this is the real trouble. You know what will happen? Now the real meningitis game will start. Remember, bacteria damage our central nervous system. Bacteria damage our meninges, but little. You know what damages more bacteria? Our own immune system. Our own immune system. Let me tell you one thing. If there's a nasty man on the road, there's a bad man on the road and he's jumping around and this, but maybe it is not so dangerous. But three people, policemen come and two-way firing start, sometimes it is more dangerous. Same thing happen here. I will give you another example. You know, when two elephants are fighting, who suffer? Grass. When two elephants fight, who suffer? Grass. In the same way, when bacteria release the toxins and our immune system and defenses come into play very aggressively, the fight is on the meninges and brain tissue. When bacteria and our defenses fight, who suffer? Meninges and the brain tissue. So now I'm going to talk about our immune response. That is why in such patients who have acute pyogenic meningitis, we give immunosuppressive drug as a steroids, dexamethasone and others. Why we give it? We have to give antibiotics to kill the bacteria. But remember, bacteria are bad and the dead bodies are more bad. If you kill them, they are more bad. You know why? When you kill a bacteria, thousands of the toxins are released. And these toxins further challenge our immune system, and immune system is more irritated, and fight of this game, this immunological fight between the microbial products and the immune system, right, damages our tissue more. That is why as a treatment, not only we give antibiotic to kill the bacteria, we also give the steroids to suppress the immune system. Don't get over irritated. But let me tell you that where you have not given the treatment, what happens? Right? Actually what happened, that even though CSF normally has no defense, but eventually defenses will appear. From where? Let me tell you. Number one, in the brain substance, there are cells called microglia. Microglia. Right? Then there are astrocytes. What are these? Astrocytes. Then there are monocytes, right? And some lymphocytes may be here, right? CSF, lymphocytes. Then, endothelial cells. Yes, these endothelial cells. Now, all these cells start reacting to the presence of the toxins. All these cells, endothelial cells of microcirculation here, microglial cells, astrocytes, monocytes, right, and some other cells, they start reacting to the presence of teichoic acid, presence of peptidoglycans, presence of endotoxins, lipopolysaccharide. And what they do, all these cells become active. Now our body is responding, truly. Is that right? And when these cells react, what they do? they actually produce, these cells produce certain products. Right? Now our immune system is reacting and endothelial cells now behave like defense. They start producing products. Microglia, astrocyte, monocytes and others. What they produce? Number one, they produce interleukin 1 beta. Number two, they produce tumor necrotic factor. Of course, these are cytokines. And even they produce some chemokines. Chemokines. Right? And with that, our reactive cells will also produce excitatory neurotransmitters in toxic concentration. Can you tell me one excitatory neurotransmitter? Glutamic acid, right? Excitatory amino acid like glutamic acid in toxic concentration. They also release oxygen-derived free radicals, reactive oxygen species. They also release nitrogen reactive nitrogen species like nitric oxide and other products. So what happens? That our system has become angry, and anger is not always good, right? So these angry cells, microglia, astrocyte, monocytes and endothelial cell, they start producing the products. These products are different cytokines like interleukin 1 or tumor necrotic factor or chemokines. With that, excitatory neurotransmitters and oxygen free radicals and nitrogen free radicals, toxic products. Now what will happen? These cells are not stupid. Some of them have beneficial effect. Some of them have beneficial effect. But I tell you, whatever fight you do with all your good intention, it is going to bring something bad. Is that right? Beneficial effect is interleukin 1 and tumor necrotic factor and chemokines, they act as pro-inflammatory mediators. They act as chemical mediators of inflammation. What they do? They lead to, some of these products, they lead to arterial dilation. Blood flow to the system will increase because antibodies are in blood. Complements are in blood. Neutrophils are in blood. And these things are not there in the CSF where bacteria are challenging us. So what we have to do? We have to bring more blood here. So these products, which actually, the good thing what they do is they lead to arterial dilatation. More blood flow will come here. With that, if more blood flow come, but endothelial cells are together. They don't allow the passage of proteins. Here, some of these cytokines like tumor necrotic factors, they will produce interendothelial gap. That endothelial cells, they will shrink. And if endothelial cells will shrink, let's suppose endothelial cells, I will give you an example. These are 3 endothelial cells. Right? When chemokines will act, these cells will shrink. And when they will shrink, they will, right, interendothelial gap are produced. Through these gaps, what will happen? Through these gaps, protein-rich fluid will come out. And these proteins, many of them will be complement and antibodies. So what is really happening? That these fighter cells, angry cells, they release cytokines with good intention, even though later on we'll see with these good intentions, some bad things will also happen. But good intention is produce arterial dilatation, bring more blood flow here, produce in microcirculation, produce interendothelial gap so that protein-rich fluid come out, of course from pial microcirculation, from cerebral microcirculation, from arachnoid capillaries, all this process start going on all around. Microcirculation, interendothelial gap appear and protein-rich fluid is coming into CSF, right? Loaded with antibodies and complement. And then under the influence of these different type of cytokines and especially chemokines, chemokines are those cytokines which stimulate the chemotaxis of neutrophil. Actually,